Good morning, Ohio. This is Jason Schwartz with the National Council of State Boards of Nursing. I'm here today to talk to you about the next generation NCLEX. Give me 1 second here. I'm going to share my screen and then we'll get underway. Okay, fantastic. So this is next generation NCLEX countdown to launch. As you may know, the next generation NCLEX, or NGN as we sometimes call it, is launching in just under 5 months, April 1st, 2023. My job today is to give you an overview of all the changes coming to the exam. Some of them you probably already know about. Some of the information might be new. Let's just jump right in. So there we go. I always start with the legalese, but I like to say if you see something, share something. So if you are attending this presentation, you probably have colleagues and definitely have students who would benefit from some of the same information that you're getting from me today. I'd like you to share it freely, and you will have a copy of these slides. Small print at the bottom is if you see something that you would plan to sell or use commercially, we have an email address and you just need to get our permission in advance. So what do I plan to cover today? These are really the big questions. Why is the test changing? What do the new items look like? What does the whole test look like? How will scoring work? Because scoring is also changing a little bit. Do we have some new resources at NCSBN that can help you? I think so. And also some updates that I'll share before we close. And then finally, I'm happy to take questions. Probably the most efficient way to do that is to send those to education@nursing.ohio.gov. And then the good folks there can pass those along to me and I'll try to get those answered. So let's just get started. Why is the test changing? I'm going to give you some early history. This is 10 years ago, even more than 10 years ago, January 2012, we had a meeting of what we call the NCLEX Examination Committee. Now, the exam committee is a group of regulators. In fact, we've had strong representation from Ohio. And this group of regulators has oversight over the NCLEX, essentially making sure that it is an exam that assists regulators in their efforts to protect the public. So a question that came to us, this was from Jan Hooper at the Texas board. She's still there today. She asked us, is the NCLEX measuring the right things? Well, that's an interesting question. On one hand, the answer is, of course it is. That's why we do our triennial practice analysis. We conduct scientific studies of exactly what entry-level nurses at the RN level and the PN level are doing. And we even get data from that same study on frequency and criticality. In other words, we know exactly what entry-level nurses are doing and what they need to know to be able to do those things. So of course, we're measuring the right things. However, Jan's question went a little deeper than that. I'm going to give you a little bit of testing theory. I hope that's okay. With any test, it's really a combination of what you want to test and what you can test. So what Jan had in mind was clinical judgment. Now, in the testing world, clinical judgment, decision-making, communication, problem-solving, ethics, we think of these sometimes as soft skills that are very difficult to test, if not impossible. I want to contrast these with things that are traditionally considered easy to test. Factual knowledge, applications of concepts, right? So we had, I'll call it a moment of truth. It might have been easy to say, well, we're definitely measuring all the things we can measure, and something like clinical judgment, we just can't really measure. Instead, the way we approached it was to say, what would it take to measure clinical judgment? And obviously the answer wasn't too easy because here we are 10 years later and we haven't launched yet, although we are very close. So out of Jan's question, pretty immediately we followed up with 2 studies, one a literature review and one a new version of the practice analysis that we call the strategic practice analysis. I'm going to give you now about 5 years of work compressed into 5 minutes. Let's see what we can do. So we'll start with the literature review. And this first bullet I have here is essentially saying the NCLEX would really just be catching up to education, at least in a lot of programs. In other words, You all know as educators how important clinical judgment is for nurses, and this is something that you already put some focus on, right? So education around clinical judgment, already there, pretty standard for nursing curricula. And by the way, this literature review was back in 2012. So by 2022, definitely. Now let's look at this row of numbers. Half of new nurses involved in errors, with about 2/3 connected to clinical judgment and decision-making. And on the employer side, only 20% of employers were satisfied with the clinical judgment and decision-making skills of their new hires. What did it all add up to? Well, I'll tell you something you already know. Clinical judgment is critical to patient safety and public protection. But I want to highlight a key phrase, even at the entry level. Some of you I know have read the literature on clinical judgment, and you know that it can and should get better over time with experience. But what did we find in our literature review? It cannot start at zero. To provide safe and effective care, even on day one, some baseline level of clinical judgment is needed. We're going to shift gears now and go to that strategic practice analysis. So there is a thick document that you can download from the website and read through, but there's a picture that goes with it. And this is probably the picture worth 1,000 words. This is the one that gets all the attention. So let's take a look. You might see a spider web or some other crazy looking thing on your screen, but I'm going to pretend it's a clock. So from around midnight to maybe 7 a.m., right, when your students are doing their best studying, we have 63 different nursing skills. Think of something like therapeutic communication as one of those. And then from 7 o'clock on up to noon, we have 41 nursing tasks. The way this part of the study went, these 41 nursing tasks were observed by researchers, and through direct observation and follow-up interviews, they were able to associate with each of these tasks the skills that were useful in performing these tasks. Well, you know, as educators, when you teach a particular nursing skill, chances are it's going to be used quite a bit, not just to do one thing, right? Well, let's see what the study showed. A fairly typical picture was that a given nursing skill fed into 5 to 10 tasks. We're going to jump around the clock here and you'll see that picture reinforced. 5 to 10 tasks, 5 to 10 tasks, 5 to 10 tasks. This one a little more, maybe 12 or something like that. This one a little less. But we come to clinical judgment, skill 33 in the study, and what you see here is that it connects to virtually every task that was observed, 34 out of 41. What's the conclusion here? Clinical judgment, not just something that the new nurse would need on an unlucky day, but really something that is pervasive in nursing, right? Something that will be used constantly in almost everything that the nurse does. So let's add it all up. Where did that take us as a result of these studies, the literature review, the strategic practice analysis? Well, reinforced that clinical judgment is important and necessary, even at the entry level. Number two, let's look at the exam today, or as it was around 2012, because really it measures about the same thing today as it did then. Well, it addressed clinical judgment a little bit. You might be familiar with items like which of these clients should the nurse see first, where there's some prioritization going on. But at the end of the day, it was limited by the item types available. I'm going to pause here and give you an example. I'm going to take you back to high school English, if that's okay. So remember what I said before. Your test is really a combination of what you'd like to measure, but what you can measure. So high school English class, you had a teacher who cared if you could write a strong essay. On the other hand, let's pretend that that teacher only had a multiple choice test. Well, you're not going to be writing an essay. You might answer some questions related to essays. Where should you put your topic sentence? How many pieces of evidence should you use to support a major point? These kinds of things, but you're not writing the essay. Well, that's about where we are with the NCLEX today. We can get at some aspects of clinical judgment, but at the end of the day, we sort of run out of gas with the item types that we have. Let's now go to number three. How could we get there? Remember, that's what we were looking at. What would it take? to measure clinical judgment, or specifically provide direct evidence-based measures of clinical judgment? Well, as the answer always is, additional research, right? Everything we do with the NCLEX is based on research and data, and presumably the use of, or the invention, I'll even say, of new item types. So here we are 10 years later, right? We're almost at the finish line, not quite there. But I like to say we're not slow, we are thorough. Okay. With that, let me just highlight again. So what's really the difference between today's NCLEX and the next generation NCLEX launching in April? We are adding direct evidence-based measures of clinical judgment. So how do we measure it? Remember, I talked about those soft skills: clinical judgment, decision-making, reasoning, problem-solving, ethics, professionalism, et cetera, right? How do you measure these things? We had quite a breakthrough. It was the development of something that we call our clinical judgment measurement model. And before I show it to you, I just want to highlight something. You'll see in the upper right-hand corner a thumbnail of one of our newsletters. Every topic that I cover with you today, we have a newsletter that goes in depth. You're going to find today there are some topics I spend a while on, and you feel like I've covered it pretty thoroughly and answered most of your questions. You're also going to find there's some topics where I go pretty fast. The important thing to know, if you ever need more information, the newsletters tackle these topics with a lot of depth. And of course, you can kind of pace yourself and take your time, read through it at your own pace. So notice in the corner here, we have a whole newsletter on the clinical judgment measurement model. I'm going to show it to you now, and there's a lot there, right? It takes a whole newsletter to walk you through it and explain everything. I'm going to focus on what we call layer 3, right? Sometimes I joke about the model that, you know, it's got so much going on. I say, man, look at all the bubbles, boxes, arrows, and even pentagons down at the bottom. But here's the good news, right? Besides having a newsletter to walk you through the whole thing, layer 3 is where every new clinical judgment item being added to the exam is written. These are the 6 boxes where the magic happens. Think about our case studies, for example, and I'm going to be showing this to you, right? I am going to make these connections for you as we go through the case study. But the point is, case study, 6 questions. Look here, 6 boxes, no coincidence. The questions in the case study follow these 6 boxes in this exact order. If you've heard about bow tie and trend items, and I'm going to show you those too, same thing. Those items are all hitting one or more of these 6 boxes. So I don't want to undersell layer 0 through 2, layer 4, right? Those are important parts of the model as well. But let's keep our focus today on layer 3, where every new clinical judgment item for the next generation NCLEX is being written. With that, let's take a look. We're going to start with the case study. So, terrific newsletter. We've got about 20 newsletters now. We add a new topic roughly every quarter, so no shortage of newsletters for you to go through. If somebody told me they only had one, they only had time to read one newsletter, well, this is the one on the case study. Why is that? Well, I think it's an excellent one. It really explains things well. But keep in mind, the case study is the single biggest, most visible change coming to the exam. By the end of this presentation, you'll know about quite a few changes coming to the exam. But again, the case study, the biggest, most visible change. So let's take a look. Here is what the case study screen will look like for your graduates. So I can kind of walk us through the anatomy of the screen. I'm going to just put some bright numbers next to the pieces. Your graduates won't have these numbers, but they'll help us today. Where I've put the bright number 1, case study, screen 1 of 6. That's the "you are here," right? That alerts your graduates that it's a case study, right? One of the things that should cue them to is all this information they're about to read on the left side of the screen isn't just for one question. It's going to be for 6 questions in a row, right? So read it carefully, right? Don't just skim it or something like that, right? I mean, it's going to be used not just once, but 6 times. Where you see the number 2, I like to say we're just setting the table for that information, right? It's giving you a 1-sentence summary of the client situation that you're in as the new nurse. Where you see the 3, 4, 5, and 6, and if you know about exhibit items on today's NCLEX, this might look familiar, but at any rate, we have simply taken all the information about this client situation. The term I use for that is the scenario, and we've organized it into tabs. Here's what I need you to know, though. You see 4 tabs here. That's not a magic number. That newsletter I referred you to on the case study has a different example, and that case study starts out with only 1 tab, right? You could start out with 3 tabs. You could start out with 5 tabs. 4 is not a magic number. What will be true about all case studies? Simply that you have a lot of information on the left-hand side of the screen and that we've organized it for you, or for your graduates, I should say. What else? I alluded to this a little with the newsletter example. The number of tabs could increase as you go through. In this case, you can see we already have laboratory results. However, you can imagine situations where the new nurse encounters a client, gets quite a bit of information, but doesn't have lab results yet. Well, imagine halfway through the case study, the lab results have arrived. And there you go, new tab, right? An extra tab shows up. All right. Let's go over to the right-hand side of the screen, and that's where we have the question, or in this business, I'm trained to call it the item, right? The thing that your graduates will need to respond to or answer. And of course, we will have 6 different ones, 6 different screens. We will follow those 6 different boxes at layer 3 in order. You'll see that very soon. So this is what the screen will look like for your graduates. For any of us looking at this on tiny phones or with vision like mine, it helps to blow up half the screen, twice the size. So we're going to do that. This is the left-hand side of that screen, right? For your graduates, they'd still have the item on the right. We can imagine it there if we like, but here we go. The text is a little bit bigger. Now, I've been doing these Zoom presentations for more than 2 years, and I can tell you, not only do some of my attendees watch on their phones, I have other attendees who watch while driving in their cars, and I don't want to cause accidents, so I've gotten in the habit of reading all this information. Obviously, you can probably read it to yourself faster than me, but I'm going to do it anyway. So the nurse is caring for a 17-year-old male client who reports a recent injury to the left thoracic cage. Let's look at the history and physical. Client reports injuring left ribs after being struck by a mechanically pitched baseball in a batting cage last week. I've got the World Series theme here for the week, right? He has bruising, significant bruising, and feels lightheaded. Also reports some intermittent pain in the left shoulder, denies shortness of breath, some discomfort in the left lower chest when taking a deep breath. Reports feeling abdominal fullness, occasionally nauseous. No significant past medical history. Search history includes orthoscopic repair to the left shoulder for a torn rotator cuff last year. Has not felt well enough to attend baseball practice since the injury. So that's quite a bit of information, especially when I read it out loud. I think it really sinks in just how much there is there. But of course, that's not all. We also have nurse's notes. Patient appears pale, slightly diaphoretic. Large amount of bruising noted along the left torso and over the LUQ of the abdomen. Patient is guarded, and there's tenderness upon palpation, dullness to percussion over the abdomen. Slightly diminished breath sounds on the left, productive cough noted. ECG shows normal sinus rhythm. Now let's take a look at the vitals. We've got blood pressure 90/50, pulse 116, respirations 24, temperature 97.8 or 36.6 for our friends north of the border. Oxygen 98% on room air. Lab results, and we've got a surprise for you, but let's focus on the values first. Hemoglobin, 9 grams per deciliter, hematocrit, 27%, white blood cell count, 19,000 per cubic mil. Now, look at that last column, reference ranges. This is something new coming in April. When we provide lab values, we will also provide reference ranges. One of the things, and as I recap the case study at the end, we'll talk about it, right, is authenticity, real world, right? Well, part of real world, of course, these days is when you get those lab values, the reference ranges almost always come with them. So this is a change. And by the way, not just for the case study, throughout the exam. If a lab value is provided, the reference range will come with it. So with that, we've now taken a look at all the information in the scenario, and we're ready to look at the very first item. Here we go. Which of the following assessment findings require immediate follow-up? Select all that apply. So before we talk clinical judgment, let's just look at this item type for a second. What is it? Well, probably all of you look at it and you see a select all that apply item, but it has extra answer choices. In my shop, what you call select all that apply, we usually call multiple response. So we call this extended multiple response. In other words, multiple response that just goes on a little longer, right? If you want to call it extended select all that apply, that works too. But what's the main point? It's a very familiar item type, but with extra answer choices. In fact, in this case study, we will see this item type appear 3 times out of the 6 items. Now that 3 won't be a magic number. That doesn't always happen, right? Just like when I told you about the 4 tabs not being a magic number, right? But the point is, this item type is quite common when we talk about our case studies. Okay, but what's really going on here? Let's focus on clinical judgment. If you were to count, and I actually haven't yet, I should, if you were to count how many pieces of information we went through, how many things did we learn about this client in the scenario, I think it would be 80 or 90. I know there was a lot of different things, right? Well, what's important, maybe all of it, right? Maybe it's all important, but can the new nurse or even the experienced nurse respond to 80 or 90 things all at once? Not really, right? You have to say, what are the things that stand out? What are the things I need to worry about right now? So that's what's going on here. Which of the following assessment findings require immediate follow-up? In general, we refer to this in our model. It's that first box out of 6, recognize cues. What is of immediate concern? Every case study, pay attention to this. This is really important. Every case study begins with this exact focus. Here was a whole bunch of information that you just read or reviewed, a lot of information, 80 things, 50 things, 100 things, whatever it is, right? A lot of information. That's great. But what's most important right now? That's how every case study begins. It might not use this exact same wording, but that really is the focus. What's most important right now? That's something that you want your graduates as new nurses to be able to do, right? And you want real world situations where the client does have a lot going on. So that is how the case study starts. A lot of educators say to me, Jason, I don't want them to just know what's important. I want them to know why it's important or what it means. Well, I have good news. That's what we do. On the second question of the case study, we got you covered. So let's take a look here. Which of the following potential issues is the client at risk for developing? Select all that apply. Before we talk clinical judgment, what's the item type? Well, you just saw it. Extended multiple response. Select all that apply, but we allow ourselves 6 to 10 answer choices. Okay, clinical judgment, I kind of hinted at it. It's a why. It's okay, here were these things that are really important to focus on right now. What do they mean? How do they connect either to each other or something else that we might care about, right? Like something the client's at risk for. So we call that in our model, analyze cues. This was the second item in the case study. Analyze cues is the second box in that layer 3. So again, the case study follows those 6 boxes in the exact same order. The first box, what do we need to care about right now? The second box, why? What does it mean? Let's go to the third item. The nurse is initiating the client's plan of care. Complete the following sentence using the list of options. The nurse should first address, and we see 3 things here, abdominal pain, respiratory status, and lab results. Followed by, and we've got a second menu. If I opened it up, you'd actually see the same 3 things. So first off, what do we call this item type? We were not feeling super creative. We call it pull down menu item. But Now let's talk clinical judgment. You can look at this and very clearly you see prioritization. So keeping with our batting cage metaphor, I'm going to throw you a little bit of a curveball on prioritization. We name the box prioritize hypotheses, right? Which explanations are the most or least likely? In other words, what do we think is happening here, right? And that's certainly one way things can go with the third question. If we go back to the one we asked here, you might not explicitly see a hypothesis, right? But we're still definitely prioritizing, right? This is a little bulky, but sometimes I say, I think we're prioritizing some aspect of the client status. Well, that's a pretty long phrase to fit in one of those little boxes. But I do want you to know, when you see prioritize hypotheses, there may be a list of hypotheses that are going to get prioritized or ranked or evaluated somehow, but we may also have prioritization of this kind, prioritizing some aspect of the client status based on some implicit hypotheses, right? We have some hypotheses in mind that sort of point us to what aspect of the client status should be prioritized. Hopefully I didn't make that too complicated. Keyword prioritize. So I know I have Buckeye fans in the audience, so I'm going to switch sport metaphors and I'm going to say, we have just come to halftime in the case study. We've just looked at the first 3 items out of 6. So that's a good, good milestone in its own right. But it's also a turning point in the case study. All right, I'm about to share some unofficial information because I think it helps you understand the case study and may even be helpful for your students. The first half of the case study is all about figuring things out. If I had to come up with a job for the nurse besides nurse, it would be detective. The nurse is going through cues or clues, right? Trying to figure out, what are the clues that really matter? What do they mean? What do I think is going on? Where am I going to put my focus? Now, in those first 3 items, the nurse didn't perform any interventions or take any actions, okay? It's all about figuring it out. It's all about the nurse as detective. When we go to the second half of the case study, which is right about now, it is going to be all about actions and interventions. If I had to come up with a job for the nurse besides nurse, it would almost be nurse as magician, right? We have encountered a client in kind of, let's pretend we've got a before picture and an after picture. Well, here's the before, and we want to make this client better. We want to transform the before into an after of the client that's even better. And that's going to be through these actions and interventions available to the nurse. So let's keep that in mind as we go through the second half. We have gone through the detective phase and we are entering the magician phase. That's all unofficial. I don't think you'll find that in our FAQs, for example, but sometimes I think it's helpful just to think of the case study, which is 6 questions, as first half and second half, right? Okay, let's take a look. The nurse is speaking with the physician regarding the treatment plan for the client who was just diagnosed with a splenic laceration and left-sided hemothorax. And I know some of you are like, oh, that's what I thought it was. That's what I thought it was. Anyways, for each potential order, click to specify whether it's anticipated or contraindicated. So what's going on here? Well, we are considering, based on the client needs, what interventions might help, right? And I suppose also on the flip side, what interventions would not help or potentially even be harmful. So we're connecting the client needs to the things that could help, the outcomes maybe that we want to achieve. We call this type of item a matrix or a grid. We use that term whenever you're entering answers in rows or columns, like in this case, right? Looks like a table or a chart. We call it a matrix or a grid. In terms of the clinical judgment model, I've kind of described it. It's all about coming up with things that can help. We call that generate solutions. Now, the 2 boxes out of those 6 that are most commonly confused by educators, and sometimes even by me, to be honest, are the 4th and 5th. This one, generate solutions, and the one that we're about to see called take action. So I want to stay on this one a little longer so that you can see the difference. I'm going to use an example that's not about nursing at all. Let's pretend some of you, after you watch this video, decide you want to get together and go out for lunch, right? And somebody says, I kind of feel like Italian food. And somebody else says, ooh, but what about that good Mexican place? And somebody else says, what about that Thai place they opened down the street, right? You're kind of brainstorming things that satisfy your group's needs, right? Whether it's hunger, socializing, etc., right? These are all things that can help. On the other hand, and here's the key difference between this and the next one we're going to look at, you're not going to go to lunch at the Mexican, Italian, and Thai place, right? At some point, you're going to narrow it down a little bit, right? You're not going to go have 3 lunches. In the same way, when we're talking generate solutions, right? It's really, what are all the different things that can help? It doesn't mean we're going to do them all. It's just about finding things that could help, whether, you know, we do them all or do some of them or do one of them. Okay, hopefully that helps you a little bit. Let's take a look then at the 5th item in the set. Take action. Well, here it's kind of like we just showed up at the Thai restaurant and we're ready to order, right? Here it really is, what are the things we're going to do? So let's read the question. First, the nurse has been asked to prepare the client for immediate surgery. Which of the following actions should the nurse take? Select all that apply, right? When you check off these boxes, it means these aren't things the nurse maybe could do, but maybe not all of them. No, no, no. The boxes you check off, we're saying the nurse will do all these things, right? So it's a little more definite. It's a little more here and now than generate solutions. Item type, I mentioned you're going to see this 3 times in the set. Here it is, extended multiple response again. It's like select all that apply with some extra choices. Clinical judgment measurement model, 5th box is called take action, right? I think that's a good name given what you just saw. Now, again, I'm going to throw you a little bit of a curveball and say that you could see this item coming in 2 flavors, right? A very typical way is what or which things should the nurse do, right? That really lives up to the name, take action. But if we go here, we see a second bullet, how should the nurse do these things? Well, going back to the item, I could probably make a case that this is how should the nurse prepare the client for immediate surgery, but I do want to indicate this isn't the only way we might get there. I'll give an example. Let's pretend that the client normally takes pain medication orally, but the nurse sees cues or clues in the scenario that this client may have difficulty swallowing. Well, how is the client going to get the medicine, or how is the nurse going to assist with pain, right? All of a sudden, there's kind of an interesting how that just showed up. So back to the little, I call these mini posters about the skills, right? I do want you to know if there's a how question in the take action, it isn't something memorized out of the book, right? I know the book has some things, how to do this, step 1, this, step 2, this, step 3, this, and don't ever change the order, right? I know the book's got those things. It isn't about have your graduates memorize those lists out of the book. Now, they might need those for other things. But if we're talking about the take action item in a case study, the how always depends on the situation, right? That's a little harder, isn't it? Right? Not a memorized how, but something where you have to think a little and say, hold on a minute. Based on what I know about this client, I may need to do things a little bit differently here. All right. We are now ready for the final item in the set, the 6th item. And just like any nursing process or nursing related process you can think of, the final part of our clinical judgment measurement model has to do with evaluation. So let's take a look at the question first. Click to highlight the findings below that would indicate the client is not progressing as expected. The way this item works, by the way, is you click on some part of a sentence or phrase and it lights up. You click on another one if you want to select more, it lights up too. You change your mind, no problem. Click again, it goes away, right? We'll go ahead and click it. We'll take it. But anyways, one thing I want to point out before we get into what do we call the item, although you could probably guess, and what does it have to do with those 6 boxes, right? before we get there, I just want to point something out because sometimes people worry, right? You can imagine your graduate sitting there. Let's look at this first one. Oh no, do I want to highlight the at the beginning, right? I know especially Ohio State fans love to include the, right? Do I want to include the? Do I need the period at the end? Well, good news. Nobody's got to make those decisions. If your graduate clicks on any part, right? Let's say they like refusing or they like incentive or spirometer. If they click on any part, the whole thing lights up for them. They don't have to agonize over whether to include some word or punctuation or anything like that. So that makes their lives easier. It actually makes our lives much easier for scoring. So what do we call the item type? We call it a highlighting item. What does it have to do with the clinical judgment measurement model? Remember our nurse as magician in the second half of the case study. We've got the before picture and the after picture of the client, right? With some interventions that happened in between, surgery in this case, among other things maybe. So, okay, can your grad detect which things got better? If anything got worse, right? If anything didn't go as expected, are there some things that stayed about the same? And I know sometimes same is good, sometimes same isn't good. But at any rate, let's take a look. So we call it evaluate outcomes. That is box number 6 from that diagram we started with. And it's all about what got better, what got worse, what stayed the same, etc. So we are now going to recap the case study. I know we've spent a lot of time just now. I spend the most time with every group on the case study because, again, the single biggest, most visible change coming to the exam, right? If you really get your head around the case study and you get it and you understand how it connects back to those 6 boxes in the measurement model, life is very, very good. And all the other changes that we go through fall into place, right? So the case study, understanding it and understanding its connections to the measurement model, to me, are essential for an understanding of what's coming with the new exam. So let's recap. Real world nursing scenario, you saw that. When we have educators just like you, and I hope some of you will sign up for this. I bet some of you already have, by the way. But when we have educators come to Chicago or participate virtually in our item writing workshops, we say to them, case study, we want real world, right? If it's messy, if it's complicated, okay, is that real life? If it is, we'll take it, okay? So nobody watching this, I know, nobody watching this, but some educators out there said, Jason, I don't know if the NCLEX is real world. Sometimes I think it lives in NCLEX land. Every client has one thing wrong and needs one thing done. I don't know how real life that is. Well, okay. No comment. But I will say with respect to these case studies, you just saw, right? Look at that scenario. This client had a lot going on, probably needed a lot of different things, right? That's why prioritization is important. That's why it's important to identify what are the things I need to care about right now, right? That was our recognized cues. So real world scenario, by the way, it will include some things that might not ever be used to answer the questions, right? Extra information, because again, that's real world. You don't walk in as the new nurse and somebody hands you the report and they say, good news, I've already crossed out all the stuff you don't have to care about, right? No, that's something that the nurse needs to figure out. All right, let's keep going. Really, really important thing. If you take away only one thing from this presentation, but I hope you take away a few more, the case study, it is 6 items focused on clinical judgment, and those 6 items in order follow the 6 boxes in our layer 3 diagram. So I've reprinted these posters for recognize cues, analyze cues, etc., all the way to evaluate outcomes. And you've got bigger versions in the slide deck that you're going to have. But I'm also going to translate them. Why do I like to do this? Well, maybe not for you, but maybe for your students, right? The terminology that we use, the testing terminology that we use, things like generate solutions or prioritize hypotheses, can feel like 6 more things for students to memorize on top of everything else they're already trying to worry about, right? Well, we want to keep that focus on clinical judgment. So I always like to offer that these terms, we like them, right? We came up with them. But there's also plain and simple English that we can use to describe the case study. In order, first item, what matters most, or what matters most right now? Second item, why? What does it mean? Third item, remember we had a little bit of a curveball here, 2 flavors. What do you think's going on? Or where do you think you should start, right? Remember, which aspect of the client status is going to get priority? Now let's go to the second half, right? We're done being detective? Not really. One could say evaluate outcomes. You're detective all over again, right? And you're certainly thinking about all those cues as you worry about generate solutions and take action. But nonetheless, let's pretend we traded in our detective cap for a magician cap and wand in the second half of the case study. Well, what kinds of things could help this client? That's generate solutions. Take action. What are you going to do? How are you going to do it? And then finally, how'd it go, right? So even in plain, simple English, we can describe the case study. I don't want you to leave this presentation thinking that the case study is just 6 kind of random, complicated questions, and how are you ever going to get anybody ready for that? No, not really. These are the exact things, maybe not the only things, but these are all things that you want your grads, when they get into that workplace, to be able to answer. Okay, here's a client with a lot going on. Maybe I just learned 80 things or 90 things like we did. What matters most right now? Why, right? That's what this is all about. Let's look at the last 2 bullets on the slide. Setting. I just reviewed a case study with you, and you probably noticed this seems kind of med-surg or something like that, right? This is probably taking place at the hospital. Are they all like that? Is a good question to ask. Well, that was that example. Setting, it's wherever entry-level nurses might be. So that case study, maybe that was hospital, med-surg. However, could it have been something with a school nurse at school? Sure. Public health nurse? Sure, right? How's that get figured out, by the way? How's it get figured out where the case study takes place? Well, that's actually up to the educators like yourselves that come to our item writing workshops and write the scenarios and the case studies. There's a lot of freedom that we give as long as they follow our 6 clinical judgment steps and stay within the test plan. Now, that part about staying within the test plan, I don't know if you heard it, we got a little soundtrack for this part of the presentation. Staying within the test plan is what I'm getting to when I talk about eligible content, right? So we just learned about splenic laceration, left-sided hemothorax, and some of the care that goes along with that, I suppose. But what about things like labor and delivery? Could that ever be in a case study? Yes. If labor and delivery is in the test plan, it could be in the case study, right? The test plan describes the knowledge, skills, and abilities that we're looking for on the test. If it could be in a multiple choice question on the test, it could find its way into a case study as well. Now, you know, we all know there is going to be some point at which labor and delivery is well beyond entry level, and that's not going to happen. Everything we have here remains entry level, but topics, specialties, etc. If it's in the test plan, you could see them in a case study. All right. I promised I was going to spend the most time on case study, but guess what? That's all I got, at least for now, unless you send in some questions. So I've mentioned our item writing panels. If you want to zap that QR code, we will take you right to the sign-up sheet, or at the end of this presentation, once you get your slides, I've also just built in some links you can click on to get to this and other things, such as the case studies that I've been highlighting, or pardon me, the case studies, I'm sorry, the newsletters that I've been highlighting. Well, there we go. All right. More ways to measure clinical judgment. I've mentioned that the case study is the single biggest, most visible change coming to the exam. It is all about measuring clinical judgment, but it is not our only tool in the toolkit. So, main way, but not the only way. We've got 2 other things. I'm using a phrase here, standalone item or standalone item type. What do I mean by that? Well, picture the case study. It was 6 items all together, right? a group of 6 items. Standalone items are items that work all by themselves, right? They're not in a case study, right? It's basically, if you think of today's NCLEX, the whole thing, right? Everything on today's NCLEX, it's really just individual items, one after another, right? So what you think of as a normal test item, I'm going to call a standalone item. I hope that's okay. All right. So at any rate, we have 2 new kinds of standalone items that we've developed for clinical judgment. One is called a trend item. One's called a bow tie item. Of course, I'm going to quickly show you examples of each. More importantly, Spring 2021 newsletter that you see in the corner will tell you a lot more about each of the types. Let's start with the trend item. What is a trend item? Well, it's a single item. It's not a part of a case study, single item. But what is it? It's simply an item where we get information that changes over time. You can see here 10 a.m., 2 p.m., 6 p.m., right? We've got intake and output changing over time. We've even got some nurse notes that change over time, I suppose. And then a question. That's it. That's what every trend item looks like. Information on the left-hand side that changes over time. Maybe there's a trend in there, right? And a question about it. So I do want to make good on my word. Remember, I said every new clinical judgment item being added to the test goes back to those 6 boxes. So let's take a look at the question here. It says, which of the following diagnostic procedures should the nurse anticipate? So, well, what kinds of things could help the client? Isn't that really what we're asking? And again, that is generate solutions, right? If I were really on my A game, I'd read you that last answer choice, but I bet that's a tough one for most of us. Anyways, right. So this goes back to generate solutions. Now, I'll just point it out. If it's helpful, awesome. If it's not, that's okay. You could skip this part of what I'm about to say. But I will say, beyond just hitting generate solutions, if you really think about it, for your graduates to do well with this question, they had to recognize and analyze some cues. They might have even had to formulate and prioritize some hypotheses. So most directly, this is hitting that 4th box, generate solutions. Indirectly, we could say that it's even checking off the 3 boxes before that. Let's now go to the bow tie item. What's a bow tie item? Again, it's a single item all by itself, a standalone item. Left-hand side, we have information. Right-hand side, we have a drag and drop item, but the drag and drop item has a very particular structure. If you've seen items on today's NCLEX, sample items, because I know you haven't seen the real test. Maybe some of you took it recently enough, but point is, if you're familiar with that item type today, it's usually drag some stuff on the left to the right, right? Move some things over a little bit. Well, this drag and drop item has a very specific structure. The place we're going to drag answer choices is shaped like a bow tie, right? I like to, if you want a visual, I like to think Young Sheldon these days. We watch that every Thursday at our house, but you've got Pee Wee Herman, you've got Urkel, you've got Bill Nye the Science Guy. Take your pick of famous bow tie wearers throughout television history, and you can see this bow tie shape for where the answers go. A few things I'll point out. Let's look at the headings here. Actions, conditions, parameters. Those stay the same on every bow tie item, right? You don't need to worry too much that, could they come up with bow tie items with different things you have to think about? No, not really. It's actions, conditions, and parameters. Let's take a look at something else. In the bow tie shape, you see 2 things, 1 thing, and then 2 things, right? In terms of the response areas. I call that a 2-1-2 structure. You could imagine there could be a bow tie item where we decide to go with a 3-1-6 structure or, something complicated, but we never do. It's always this structure, 2-1-2. It's always it, 2 actions, 1 condition, 2 parameters. I'll go a step further. Look at the answer choices. You've got 5 of them, then you've got 4 of them, then you've got 5 of them. I'll call that a 5-4-5 structure. And again, that will be true for all the bow tie items on Next Generation NCLEX. That 5-4-5 structure for the answer choices, we're going to use on every single one. So, quick little note I'll say sometimes the way that we are testing these things, right? That's what we've come up with, and that's what we're going to do. But you may find in a classroom situation or something less formal than the NCLEX itself, maybe you're coming up with your own one of these, and you've got 6 actions to take where you want your students to think about what are the best 2. No problem. That's if it feels good to you, if it feels like something that's going to help you or help your students, I don't think you have to exactly match us, right? But what I am telling you, in case it's useful, is we always go 2, 1, 2, 5, 4, 5. Okay, that's it for bow tie. But again, we've got that newsletter to take a look at. So you've seen the new item types that we're adding to the test. You've seen the case study that we're adding to the test. But what does the whole test look like? People used to ask me, is the whole test case studies and bow tie items and trend items? Is that everything? Are you throwing away the NCLEX we know and love? Or how about know and gotten used to? Love may be too strong a word. We don't know. But anyways, that's what people wondered, right? Are we getting rid of the entire NCLEX to bring you something completely different? So I'm going to answer that with a picture. This picture sticks with every group I present it to. How different is the next generation NCLEX from the NCLEX? Is it a whole new exam, for example? Well, let's take a look. We're going to pretend today's NCLEX is a cheese pizza. Permit me my bad joke I always make. If it really were a cheese pizza, your students would finish faster and like it better. So we know it's not a cheese pizza, but let's pretend. Then what is next generation NCLEX? Whole new ball game, all right? Spaghetti, hamburger, Caesar salad, grilled salmon? No, it is a cheese pizza with some toppings. That's the best way to think about next generation NCLEX. It is today's NCLEX with a little bit more added. Now, what are those toppings? Well, they're the case studies, some trend items, some bow tie items. But here we go. Again, if you only remember a few things from today's presentation, here comes one of them. Well, this picture is a good thing to remember, but here we go. The overwhelming majority of items that your graduates will see on next generation NCLEX come directly from today's NCLEX, the cheese pizza. Overwhelming majority. We're going to make that real with a chart, okay? But that's how you should think about the exam. The next generation NCLEX is just like taking today's test, but every now and then, oh, a case study. Every now and then, oh, a bow tie item, okay? But at its core, we got that cheese pizza. We've got today's NCLEX, multiple choice, select all that apply, you name it, right? Fill in the blank drug calculations. All right, here we go. Let's make it real. So I've got a chart here. It's important for me to share with you. Everything you see on this chart applies equally to the RN exam and the PN exam, okay? Whichever one you're more interested in, this chart has you covered. It's the same for both, identical structure for both. Time staying the same, 5 hours. Computer adaptive testing is what we'll use. If you're familiar with that, enough said. If you'd like to learn more, I will show you a resource toward the end of this presentation where you can learn a little bit more about computer adaptive testing. How many items are on the test? Well, you can see here, next generation NCLEX gets a little bit longer. Not too much, right? Today, the most items somebody could get is 145. Starting in April, the most you could get is 150. So it's a little more, but not too much. Okay. What you may or may not know is on today's NCLEX, 15 of the items do not count. Well, why are they there? Because we need them. We need them. We are testing them out for the future, right? We're collecting data. We want to know, could this item a year or two down the road be a good item to put on the test? And the only way we can find that out is to collect data. So these items do not count for your graduates. They do not count toward the pass-fail result or the ability estimate that we use in determining the pass-fail result. They do not count at all. They simply get us some data for the future. So let's subtract 15. And now the number of items on the next generation NCLEX that count is now 70 to 135. And I'm going to give you about the most precise breakdown that you'll ever get on those 70 to 135 items. There are always 3 case studies among those items that count. We just saw there are 6 items per case study. That makes 18 items from case studies. Now, that's a phrase that can get us into trouble. When I say 18 items from case studies, you know what it means. There's 3 case studies, 6 items each. It could be easy to tell somebody 18 items from case studies, and they accidentally think we mean there will be 18 case studies, right? So be careful. There will not be 18 case studies. There will be 18 items from case studies. All righty. So what's left? Let's take away 18 from 70 to 135. I feel like I'm in TurboTax or something, right? Now subtract the thing you just got from, okay, anyways, we'll subtract. We get 52 to 117. It's not really a round number, I get that, but 52 to 117 is what's left over. Here we go. About 10% of those are going to be these bow tie and trend items, right? About 10%. So let's say you get that short test. Well, you might have 5 items that are bow tie items or trend items. Well, the other 90% are the cheese pizza. The other 90% are regular NCLEX, if that's a word, right? Today's NCLEX, essentially. Traditional NCLEX is 90% of that 52 to 117. So if you think about it holistically, right, that's what I'm talking about. Cheese pizza with toppings. The overwhelming majority of items on next generation NCLEX are coming from today's NCLEX. I want to say one thing about the 15 items that don't count, right? I know you don't care about them as much. They don't count, right? You don't need to care about them as much, but here's the small print. Just like today, we're testing out select all that apply, multiple choice, etc., as part of those items that don't count. Well, nowadays, we need to test out bow tie items, trend items, and even case studies. So those items that don't count could include bow tie items, trend items, and case studies. In particular, you may have a graduate come back to you and say, I thought you said 3 case studies. I got 4. The computer was broken. I'm going to sue somebody, right? That may happen. That may happen. And then you should remind your graduate that they've just violated the security of the exam by revealing it to you. No, I'm teasing. Well, I mean, it's true, but okay. But at any rate, there's nobody to sue. What does it mean if somebody sees 4 case studies on their exam? Nothing's broken. It's because 3 of them counted and 1 of them didn't count, right? And they won't know which one didn't count, right? Everything kind of looks the same while they're testing, but you get the idea. 3 is the number that count. Could you get 4? You sure could. Is it possible to even get 5 case studies? You'd have to be pretty unlucky, but technically it's possible because you could squeeze 2 case studies into the 15 items that don't count. The computer figures that out for us. So, right, it's not on purpose if it happens, but it could happen. So that's our test design. That's what the exam looks like. I showed you the pizza. I showed you the chart. But again, big picture, it's like taking today's NCLEX and every now and then, oh, a case study. Oh, a trend item. I got the sound effects going. All right, here we go. How about scoring? And I know I have just presented so much information, hopefully not all of it new, right? Hopefully some of it I'm just reinforcing things you've already read about or heard about or even started doing with your students. But at any rate, it's a lot of information. So let's kind of pause, take a deep breath. I have one more substantive topic before I come to just resources we have that can help you. So my final topic is the scoring changes coming to the exam. We have an excellent newsletter on scoring summer 2021. So I'm going to have a little fun with scoring. I'm going to use some examples I've created just for Ohio. They are not nursing examples. So you're probably, after this part of the presentation, going to say, okay, well, that was great, but what does it look like for nursing? Good news, we're actually going to look at it for nursing, but the point is, if you want even more, the scoring newsletter's for you, because we've got this newsletter, I get to depart a little bit and have some fun. So first, let's set the table. Scoring is changing. You know today, everything on the NCLEX is either right or wrong. Most famously, the select all that apply items. You probably have students, they graduate, they take the NCLEX, they got a select all that apply item where maybe there were 4 right answers, and maybe they chose 3 out of 4 and they got it wrong. They got a 0. That's how it works today. There is no partial credit. With the next generation NCLEX, we are introducing partial credit. And get this, important, it will apply not only to all the items I just showed you, in other words, case study items, new item types, bow tie trend, it will also carry over to today's select all that apply items, right? So part of the cheese pizza is going to partial credit scoring as well. So I don't want to make your lives too complicated, but the truth is we have 3 different ways that we can assign partial credit on the NCLEX. It depends on the item. So I'm going to try to make that clear for you with a few examples. Again, we're going to have some fun. We don't have some nursing here. We've got some other stuff. I know I got some Buckeye fans, so let's just work with it. I've got a select all that apply item here, but keep in mind the same would hold for extended multiple response. In other words, instead of 5 choices, you could picture 10 choices if you want, but fundamentally, it's just a question with select all that apply. So which of these college football legends played for the Ohio State University? Select all that apply. Well, you may know the answers here as Joe Burrow, right? Took your Bengals to the Super Bowl. Justin Fields and Eddie George, Ohio State Buckeye legend, right? Joe Burrow, you're like, wait a minute, LSU Tigers, but he played a little bit. He played a little bit at OSU. He had so many good quarterbacks that he never really got a big chance. So headed to LSU. But okay, besides the point, those are the correct answers. But let's say that a candidate, maybe they just moved here, right? Went with Tom Brady, Joe Burrow, and Justin Fields. Well, they got it part right? It's partly right. How are we going to score it? On today's NCLEX, they'd get a 0. But how are we going to score it for next generation NCLEX? This is the most common scoring method we'll be using for next generation NCLEX. Its name is plus minus scoring. And as the name suggests, when you get something right, you get points. When you get something wrong, you can lose points. So Joe Burrow, Justin Fields, those are right. They get points. Tom Brady, that's wrong. Lose a point. I have to say it. First time ever, Tom Brady's been penalized. Okay, what's the score then? 2 minus 1, right? 2 points for the right stuff, minus 1 point for the wrong one. Total score, 1 out of 3. So that's partial credit scoring in action. This is the most common partial credit scoring method we'll use. Why are we taking away points? Let's start there. Why do we take away points? Think about this. Believe me, your students will figure it out, or somebody will put it on social media and it'll go viral quick. If there were no penalties at all, your students would figure out quick, check off all the boxes. Don't even read the question, just check off all the boxes. Because if you check off all the boxes, you get all the right answers. And if there's no penalty, you just got full credit, right? So whenever you can check off all the boxes, we build in the penalty. Select all that apply. Great example of that. I'll show you another one once we get to the nursing examples. Okay. One other thing I want to say about this, and it has to do with that second bullet on the left. Potentially, when we do the right minus the wrong, somebody could get a negative score. That's possible. Well, we don't let that happen, I suppose. We always round up to 0. So the lowest anybody can get is 0, right? So in this item, you could have gotten 3 points. If you got everything right, the lowest we'll award is 0. So 0, 1, 2, 3 are the possibilities with this question. The answer I'm showing you here, this person gets 1 point. We're now going to look at an item that looks almost identical, and that's on purpose, right? But it's scored differently. Here we go. Now it's not select all that apply. Which 3 of these college football legends played for the Buckeyes? Okay, let's pretend somebody answers the exact same way. Well, the computer here doesn't let you check them all off. It says which 3, and it only lets you choose 3. Remember, the reason for the penalty was so people weren't going to game the system. People weren't just going to check off everything to get full credit. Well, if the computer doesn't let you do that, then we don't need the penalty. So how do we score it? You get the 2 points and you don't lose anything for Tom Brady, right? So similar question, same response, different score, okay? So this will happen. We'll see a nursing example come up that uses this type of scoring. Third one, there we go. There's our score, 2 out of 3. Third one, I maybe had too much fun with this one, so I apologize in advance. Some of you will get a laugh out of it. Hopefully, well, some of you might be a little grumpy from it, but hopefully you'll see it's all in good fun. Okay, we call this type rationale scoring. I did have too much fun with this one. Complete the statement using the pull-down menus. Jenny's parents knew the new boyfriend wasn't a sports fan, very hungry, or marriage material. When he showed up to Sunday brunch wearing an outfit that matched a neatly pressed shirt or, oh no, a Michigan Wolverines cap. So let's take a look here. We know the answer is he wasn't marriage material because he's got that Michigan Wolverines cap. Oh no, right? Especially, what is it, next week or something? It's coming up, isn't it? Anyways, right. So let's say that somebody chose marriage material, an outfit that matched. You could look at this and you could say, well, the first part of the question they got right. The second part they got wrong. What should that be? 1 out of 2, maybe. But rationale scoring, as the name maybe implies, is when we care about your reasoning, when we care about the connection, the relationship, we can say, you know what? We're not going to score each piece of the response, but we're going to score how they fit together. In other words, we're going to combine multiple response elements into what I call a single scorable unit. That probably sounds like some testing jargon, but the point is we're going to score the sentence rather than the pieces of it. Well, if we score the sentence or the relationship, we'd say it's just wrong, right? Now, in nursing, what's this about? Well, you want somebody to know the right thing for the right reason. There might be some questions like the nurse should question the order for medication X because of Y, right thing for the right reason. If the focus is reasoning, then we might use rationale scoring. Our newsletter is going to show you some good examples of that. Okay, apologies to any Wolverine fans in the audience there. Some of my best friends are, so okay. What are the benefits of partial credit scoring? We're just going to look at why we do this, and then as promised, I've got some nursing examples where we're going to apply these things. Measurement precision is really what it's all about for us. Picture all your graduates lined up, right? From knowing the least to knowing the most, let's pretend. Or in my case, I could say 200,000 RN test takers a year, all lined up from who knows the least to who knows the most, that kind of thing. When we have an item that's either right or wrong, right? We call that dichotomously scored. When we have an item that with no partial credit, it's all right or it's all wrong, it's going to divide the test takers into 2 groups, right? Who got it wrong, who got it right. Those 2 groups are both quite large. And within those groups, there's a lot of variance in knowledge, skills, and abilities. Let's take a look at this group that in my diagram got a question right. It includes the person in blue who just barely knew enough to get it right. It includes the person in green who pretty much knows everything, right? So big difference, but they get the same score, right? So from a measurement perspective, it's as if they have the same ability, even though you know that they don't. If we go to partial credit, what happens here? Well, the partial credit item essentially is dividing this same group into 5 categories. The 5 categories are now much smaller, and within each category, there's a lot less variance. What does that help us do? As we're trying to estimate very precisely the ability of each testing candidate, it's simply given us much more information, kind of a tighter window for where this candidate lives. So that's why we're doing it. What else though? I've got 2 subjective measures at the bottom of the slide, right? They're not things that we've got formulas for, but you looked at the case study and you probably thought, yeah, I can see partial credit going there because there's so much going on, right? It might just feel appropriate. And have any of you ever had a student who said, no fair, I got everything in that select all that apply except that one, and I got a 0. That is no fair. So this one, we'll say it's for the students. It's not why we did it, but I'll say your students or your grads will probably consider partial credit a little more fair than before. So with that, we are going to look at some nursing examples now and apply what we learned from Tom Brady, Joe Burrow, Eddie George, and company, right? Okay, so we saw this in our case study. This was the second item. Which of the following potential issues is the client risk for developing? Let's pretend, okay, here we go. Sample candidate response, let's pretend somebody checks off the first 5. It's select all that apply. They could check off everything if they want, but let's say they thought it was these first 5. And let's pretend that includes 2 wrong ones and 3 right ones. How are we going to score this? Well, the first question to ask yourself, I suppose, is, does this kind of item need the penalty built in? And how do we decide that? Well, the usual criteria is, could somebody check everything off? And the answer is, yeah, you could check everything off if you wanted to. So we do build in the penalty. What does that mean for the score? We're going to use plus minus scoring with the penalty, right? 3 minus 2. Total score here is going to be 1 point. Okay. This next one is pretty tricky. I am going to confess that when I first started drafting slides for these presentations, I assigned the wrong scoring method to this next one, right? Luckily, before I did my presentation, I thought about it more and I realized I had it wrong and I fixed it. But the point is, it's a little tricky. So if your first instinct takes you in the wrong direction, you're not alone. That's all I'm going to say. Let's look at this one. This was the 4th item in our case study, generate solutions, 4th box, if you like. So let's pretend somebody does this. In other words, hey, I think all those things could help, except maybe prepare for surgery. You might remember, by the way, the very next item was about preparing the client for surgery. So this candidate maybe was in for some bad news when they went to the next screen. But anyways, we won't go there. Let's take a look. They got 3 of them right. And of course, in that case, 5 of them wrong. So scoring method, are we building in a penalty? That's the thing to ask. Here we go. It kind of looks like you can answer everything, right? Every row anyways, but here's the truth. And again, I thought about it wrong the very first time that I was putting this slide together. It's true, you can bubble in a bubble in each row, but you can't bubble in all 16 bubbles, right? The way to get everything right, if you wanted to guarantee that you checked off every single right answer, you'd actually have to bubble in all 16 bubbles. The computer doesn't let you do that. The computer says, no. Echocardiogram, you can only pick one. IV fluids, you can only pick one, right? Anticipated or contraindicated. Therefore, no penalty needed. I got it wrong the first time, right? Maybe you did just now. No penalty needed. This is 0-1 scoring, meaning you just get a point for each thing you did right. That's a 3. There is no penalty. Okay, I've got one more example, and then we're going to get to our resources. Here we go. This was the evaluate outcomes. This was the final question in the case study, 6th box, if you like. Let's pretend sample candidate response. Somebody clicked on this, somebody clicked on this, and somebody clicked on this. And let's see which ones are right or wrong. So that first one is wrong, second one is right, third one is wrong. Okay, well, do we build in the penalty? Well, here's the thing. Could somebody click all the sentences? It turns out they can, right? And if somebody clicks all the sentences, right, not because they know that's the answer, but just because they're trying to earn all the points, right? We can't really encourage that. So again, if you can click everything, we need to build in a penalty. So in this case, we are going to use our plus minus scoring. And when we use our plus minus scoring, there's a little bit of a twist. 1 minus 2 would actually get -1. If you were really paying close attention when I reviewed plus minus scoring, you might remember though, we don't give a negative score. We round up to 0. So in this case, it is a 0-point response. And this gives me a chance to highlight something, by the way. We call it partial credit scoring. It doesn't mean that no matter what somebody answers, they're going to get some points, right? Part of partial credit scoring is you could still get 0. So here's an example of that. This is a 0-point response. If you were thinking -1, guess what? I'm going to give you partial credit because if you were thinking -1, you did do the very important step of recognizing that plus minus scoring was the correct scoring method, right? And now the teachable moment is just remember, we always round up to 0 if it's a negative score. All right, y'all, we've covered a lot. So let's now take a look at some resources that we've developed at NCSBN that hopefully can be helpful to you. And then I also just want to share some general updates relevant to the exam. First off, those newsletters. Here's a picture of 8. I couldn't fit them all. I couldn't fit them all on the screen. We got about 20. We've got about 20, and every quarter we seem to come up with another topic to write about. So point is, these are terrific. Any topic, especially one, maybe I was too confusing or I went too fast or you still have questions, that newsletter is probably your starting point. First thing to go take a look at. Again, 20 newsletters. It'd take you a while to read them all. If you only had time for one, it's that case study newsletter, Spring 2020. I'm going to give you a direct link to that in just a second. But newsletters, super important. What else? Next Gen Nurse, I got to get sideways for this. NextGenNurses.org is the name on the side of the slide. This is a website we've created at NCSBN, and we are trying to pack it with stuff that can be useful not just to you, but even to students when it comes to next generation NCLEX. NextGenNurses.org. We're focused on next gen NCLEX. Take a look where we see that flashing orange arrow. It is pointing you to sample questions. So I know, especially if you hadn't seen this before, it was super helpful to you, I bet, to see that sample case study, to see the sample bow tie item, to see the sample trend item. We've prepared PDF packets for RN and for PN that give you more sample case studies, more sample bow tie items, more sample trend items. They're free. Right? You click on a legal thing that says you're not going to sell them. That's it. Right? And then it's a free download of PDFs. So that is pretty new. A lot of people do not know about these yet, but I want to make sure that you do. Go to nextgennurses.org, and pretty near the top of the page, you'll see the free download link. Oh, this is embarrassing. That guy at the bottom wore the exact same outfit as me, I think. This is very funny. Maybe I need more variety in the wardrobe. But at any rate, I mentioned earlier, if you don't know about computer adaptive testing, I've got a video for you. It's about 6 or 7 minutes. We'll be adding other things here as well. One of the things we're working on that I think is probably any day now is, remember the cheese pizza as part of the exam? We are going to be adding about 100 of each RN and PN items to go with the clinical judgment stuff. In other words, if you want to see what the whole exam looks like, well, we have something, I think we're calling it exam preview packs, that essentially insert those case studies, bow tie, and trend items within sort of the larger universe or larger exam with multiple choice, select all that apply, today's NCLEX. So coming soon. In fact, by the time you watch this video, it may be there. Go take a look. All right. Some NCSBN updates covering 2 things here, the test plan and the passing standard. So separate from clinical judgment, NGN, all these other things, one of the things you know about is every 3 years, the test changes a tiny bit, right? We have our test plan, and our test plan is due to update April 1st, 2023. That's for RN and PN. And our test plan is really 2 things. There's more information there, but I'm going to focus on 2 big things. Well, one, it's the percentage of items attached to each of our 8 major client needs categories. If that's testing jargon for you, what do I mean by our major clients needs testing categories? I mean things like management of care, safety and infection control, health promotion and maintenance, pharmacological therapies, etc. All right, I'll pull up a slide with all of them soon. But anyways, going from memory there. Okay, so it's those percentages, that's important. But it's also, remember when we were talking about what stuff could go into a case study, it also outlines the eligible content for the exam. We sometimes call these our activity statements, maybe 150, 200 things, right? Within safety and infection control. What do you need to know? Right? What does the new nurse need to be able to know? What is your grad What might they see on the test, right? So there's a lot there. These are pretty thick documents, but they're really a great preview of the exam. So these documents normally are ready around the first of the year. We know this time that there's extra interest. We are shooting for a month early. So about a month from now, these test plans should be published. Test plan percentages, those are already known. I'm about to show them to you on the very next slide. What about the passing standard? Well, that always changes when the test plan changes, right? Or at least it's reviewed to possibly change. So we are working on that now, and it will go to our board of directors. In other words, recommended updates or non-updates to the passing standards will go to the board of directors of NCSBN in early December. And as soon as they've made a decision or approved recommendations or come up with these new passing standards, we will look to share them ASAP, maybe even the very next day. So early December on that, effective April 1st again, right? Okay, let's take a look at those percentages that I mentioned. We're going to start with the RN exam. I've got the current test plan in that middle column, and I've got what's coming April 1st, 2023 in the final column. I've highlighted a few changes. Management of care, I call that RN01 in my shop, but anyways, management of care is going down by 2%, making room for very small increases of 1% each in safety and infection control and pharmacological therapies. Those are each going up by 1. Okay. This, by the way, is pretty typical for a test plan update. You never see a big change, right? And by the way, over the course of an exam, let's say it's 85 items or 95 items, how noticeable is a 1% change in one of these categories? Not very, because guess what? All of these, when we actually administer the test, are plus or minus 3% anyways. The CAT algorithm is allowed a little bit of room for error, plus or minus 3%. So really, big picture, the test probably, other than the clinical judgment, will feel about the same as before. So even though 3 categories have changed, they haven't really changed enough for the test to feel very different. Even still, I know you like the detail. Here it is. Let's go to PN. No changes. So I'll just make a quick comment while I've got you here. PN, the percentages are staying exactly the same. What I need you to know, this wasn't a huddle at NCSBN where, you know, maybe me or some folks in the exams department got together and said, let's just not change anything for PN. That isn't how it works. Everything comes from data. At the very beginning of the presentation, I mentioned the practice analysis. The practice analysis that tells us exactly what entry-level practical nurses are doing these days with frequency data and criticality data. And what the data ultimately pointed to is that these percentages, essentially coincidentally, ended up the same as before. So it wasn't a policy decision to just not change the test. It's that the data led us here, and the percentages ended up being the same as they already were. So does that mean PN is not changing at all? Well, no. Again, when the test plan is published a month from now, you're going to want to look at those activity statements. You may see some new ones, right? Oh, this could be on the PN test now? I didn't think that was on there before, right? It could be some went away, right? And it could be that some changed a little. So at the level of the activity statements, PN is updating, but at this higher level of percentages, it just happens to be staying the same. Oh, and of course, the clinical judgment is happening too, right? There's case studies, bow tie items, trend items, et cetera. So obviously those are changes. With that, where can you find all of this? Well, you're going to have these slides. You can click on that first link to get to all the newsletters. If you're in a hurry and just want that case study, I've created a separate link for that. If you'd like to do our item writing panel, highly recommend this. By the way, this is if you really want to know case studies inside out, not just learning it from me talking about it, but learning it because you did it. You worked on it for 3 or 4 days and got great feedback from our facilitators. This is the way to get there. right? This is an intensive, immersive, but enjoyable, I hope, experience. Okay, so you click on that link. What else? Well, those free samples, right? The brand new PDF packets we've put together, those are at nextgennurses.org, kind of near the top of the page. Test plans, you could click the link today, you just get today's test plan. Come back in a month, around a month, click the link again, you'll see the brand new ones. So there it is. And I've got my email address for you. I'll also say, if you have questions just from this presentation, education@nursing.ohio.gov, and the good folks there will get your questions to me.